welcome. I'm Cynthia Corsetti, executive coach, author, and speaker based in Sewickley, Pennsylvania. With years of experience in guiding leaders to realize their full potential, I've embarked on a new journey to bring those insights to a wider audience. Care to Lead, a podcast dedicated to diving deep into the world of leadership. In each 30-minute episode, I sit down with inspiring individuals from diverse backgrounds to explore pivotal moments in their leadership journeys, the challenges they face in today's ever-evolving business landscape, and the legacy they aspire to leave behind. Together, we uncover valuable lessons and insights that can empower each one of us to lead with purpose, compassion, and resilience. So whether you're a seasoned leader or just starting your journey, join me as we discover what it truly means to care to lead. Hello, and welcome to another episode of the Care to Lead podcast. I'm your host, Cynthia Corsetti, and today we're diving into the world of disruption. Joining us is Jacob Cohen, a seasoned professional with an impressive 2-decade journey across various sectors, including marketing, healthcare, IT, and financial services. He's the brains behind Mangoceuticals, and he brings a wealth of experience from his time in investment banking, advising companies, both private and public, on raising capital. Before venturing into Mangoceuticals, Jacob was at the helm of several boutique investment and strategic advisory firms. He also played a pivotal role as CFO of the Renewed Group, known for its eco-friendly reused jeans, and EVP and controller of Metascan Incorporated, where he was crucial in restructuring and raising significant equity funding. Jacob, welcome. Thank you for joining us. Is there anything I missed that you'd like to make sure our listeners hear?
No, I'd like to hear it again because that was a very flattering opening. So thank you so much for that. Appreciate that.
Well, thank you so much for joining us. Your approach to telemedicine, and particularly in men's health, seems to have been a game changer. Could you share with us what inspired you to step into this specific niche?
I mean, it really goes down to the overall arching theme of this interview, and that's disruption, and that's being different, and leading by change. And the reason we kind of dipped our toe into this market was because we saw that there was an opportunity for change. A change already existed in how consumers bought and purchased pharmaceuticals, and also saw their doctors. They changed from going to a brick and mortar facility or going to their local CVS to buy their pharmacy drugs, their drugs, and also how they see doctors. And so that shift already has been made by going online. There's more comfort with them to go online to seek these products and seek medical counsel. And so with that, we decided to take it a step further and add additional innovative products that we could market to these various demographics that we're going after, specifically men's health. Mm-hmm. So that was the overarching theme, is we just wanted to be disruptive in this marketplace and continue on that path.
So how large is your company? Like, how many employees do you have?
We've grown rapidly since we went public back in March. We're now at about 15 employees. Most of them are based on our headquarters here in Dallas, Texas. It's very important to me. I like to create a nurturing environment, an environment that's open for collaboration. Me specifically, I like input from all players of my team. It doesn't matter if they're in finance, if they're in marketing, or if they're in operations. Every time we get together, whether it's discussing a new product, how to market a product, going over slogans, going over strategy, I really value everybody's input. And I find having everybody at the office, being able to collaborate, bringing anybody in and out of the conference room at any time to talk about it and get ideas, is a great environment. So we're based here in Dallas, and most of our employees are located here at our headquarters.
That's really interesting. And because when you're growing fast, sometimes hiring people is a challenge.
Yes.
It's a challenge to find people, but it's also a challenge to find people that have passion for what you're doing. So how do you go about screening for passion or identifying passion?
Well, I think, that's a very good question, because what we're trying to do, we're in essence in a startup environment. And we're trying to find the right mix of people that both have the skill set for what we need them to do, but also have that entrepreneurial spirit. And not many people have both. So it's very difficult. So in our interviews and screening, we obviously take a look at what they've done in the past. Have they tried to venture on their own to do something? Have they only been working within a controlled 9 to 5 environment? We ask them about their future goals, what are their aspirations, et cetera. Because again, everybody in their respective role, we believe needs to be a leader in that position. And the only way they can do that is to have that innate entrepreneurial and spirit to want to be able to succeed and take on a project and make it their own, take ownership of that project.
That's very true. As a business owner myself, and I've grown up my entire life, with family-owned businesses and so on, no one ever cares as much about your business as you do. But
That's
you
right.
can genuinely find a team that is pretty darn close to where you are. But sometimes it takes time, and you go through a lot of people. It's kind of like a dating app. You just end
Yeah.
up going through a lot of people before you find the right ones.
But I think it's also a matter of them having to get on board with your vision and believe that what you're doing is a differentiator in the marketplace, that there's room to grow. So in finding people that want to get into our industry was difficult. I'm not going to lie to you, because the first product that we launched was has a lot of taboo and stigma around it. It was an erectile dysfunction drug. And so a lot of people, when we were interviewing them, they were a little hesitant in wanting to get with a company that was selling, pills for erectile dysfunction, just because of the nature of that space and that topic. So we definitely needed to have people that were open-minded, saying, listen, we're not just a, erectile dysfunction drug company. We're a men's health and wellness company. We are launching additional products, but every product that we launch, we're going to be following our recipe for success, which is number one, making our products innovative, products that are not found in the market currently. Number two, we're going to market them in a form and fashion that's currently not also being marketed. We're using humor. We're using humor to educate. We have slogans and taglines that are very, kind of they're in your face a little bit, right? We kind of push the envelope a little bit. And number three, our packaging and everything that we do, creative packaging, has to be on point. So when the customer gets it, they touch it and feel it. It doesn't look like a medical product. It looks like something that's going to help them and empower them. So those are our really three key attributes that we apply to every single product that we launch into the market, and that we will be applying on all additional future products that we launch. So it's we have to have people really sign on to our vision and believe in what we're doing, not only from a company standpoint, but how we're going to grow. And some people said, hey, I don't want to be a part of this, because of the erectile dysfunction. And some people I'm on. I love what you're doing. It's so different. It's so new. It's refreshing. And it's, as a CEO and the starter and the founder of the company, it's been really great to see how people really have hopped on the bus, so it's been great. Yeah.
It's interesting if you have people who decide they don't want to work there because of the product, because they can't imagine what they'd say at a party when someone says, what do you do for a living? My guess is that's not a creative enough person to be working for your organization anyway. So
100%.
Probably a win.
Yep. That's not the person we want working for us. So if you're ashamed of what you do, yeah, you shouldn't be working with us. So but I will tell you that, I can kind of give you an example. Our third or fourth employee that we hired, she's such a sweet girl, very reserved, very, kind of shy, but she was hired as initially to be a kind of a marketing brand coordinator. And she's just really come out of her shell and really has embraced it. But I think in the beginning she had a little reservation, but now she's really excelling at her job, loves what she does. And we also create a very, very open environment, right? So I think that helps a lot,
I like how you described it's not just that you're disruptive in your industry as a whole with your product, but you're just disruptive in marketing, you're disruptive in packaging, you're disruptive in everything. So that I really like that. What is unique about your advertising? What do you do differently?
Well, again, because initially when we're talking about erectile dysfunction, and call it a stigma, call it a taboo topic, people don't like to talk about it. Again, when you it's like, how do you break the ice on talking about something that you don't want to talk about? Well, if you make fun of it, and I'm not making fun of the
Right.
issue of erectile dysfunction, but if you say things in a playful manner and you and add some humor to it, it kind of takes it down a little bit where it lowers people's guards where they can talk about it. And the one thing that I'm trying to do in one of my missions in talking about disruption is actually changing the script. For us, I believe that if you say erectile dysfunction, and I'll give you an example, 9 out of 10 guys that I talk to, friends, colleagues, investors, you name it, I say, yeah, this is an erectile dysfunction drug. It hits faster in the bloodstream. It's got 3 ingredients. It's yada, yada, yada. It tastes like mango. And I'm like, you should try it sometime. And 9 out of 10 of them said, I'd like to try it. Not that I need it or anything, right? But would love to try it. And I get that response all the time. And why do they respond that way? Because of the word dysfunction. Whenever you hear dysfunction, you hear something's wrong with you. So, and we're not saying something's wrong. It's just something, hey, you can have, it could be better. You
Mm-hmm.
know, it's not that I'm overweight, but I could stand to lose a few pounds. You get what I'm saying? It's just how you change the terminology. So I'm actually trying to change it from erectile dysfunction to erectile function. We focus on erectile function. We're not saying it's bad, but it could be better. You can
Yeah, I like that.
have good sex or you can have better sex.
Mm-hmm.
You can go to the gym and take a pre-workout and have a great workout taking pre-workout, or you can go to the gym without anything and have a decent workout. So that's the way we're kind of trying to shift that script. So where people are like, yeah, I'll take it because I'd like to have a better experience and also give my partner a better experience.
Yeah, that's just smart because you're right. Anything that has that negative connotation immediately puts up a barrier between people. And once that barrier's there, you're going
Yeah.
nowhere.
I'll give you another case in point. We just launched our hair, a treatment for hair growth. We just launched it last week. It's called Grow. But if you look on our website, it's not under products, it's not hair loss. We call it hair growth.
Mm-hmm.
And a lot of people are like, oh, it's a hair loss product. Well, no, this is a hair growth product. Change a negative to a positive. It's amazing what you could do from a marketing standpoint.
I'm curious if that affects your SEO though. Do people do searches for hair growth or do they do
Mm-hmm.
searches for hair loss? Would that
Well,
impact
again, we still have to play the game on SEO and AdWords, and we still have to use erectile dysfunction and hair loss. And,
just
nobody's
because of
doing
that?
searches. Yeah, nobody's doing searches for erectile function or hair growth. But, so from that standpoint, and SEO is more under the covers, if you will, right? Those are
Mm-hmm.
tag words and stuff. But from our marketing message and our direct marketing approach, that's definitely very, very much in your face.
Well, hopefully, if all goes well, they will be Googling exactly what you're calling it
Yeah,
because that'll become the go-to household
yeah,
word,
that's right.
right? It's growth. That's the
Look, I want
plan.
mango to be a
So
household word. So,
yeah, awesome.
yeah.
So as a leader, it
Hmm.
often involves you're navigating tough decisions. Can you share an experience where you had to make some difficult choices in your business and being in a startup?
God, how much time do you have? So, I mean, every day there's a difficult decision, and again, they could be as minute as a decision about when to launch a certain ad campaign. It could be a decision as to whether or not we need to change personnel. It could be a decision whether or not to go out and raise capital in this market. Every day we're faced with a lot of hard decisions to make. But again, as a leader, you have to trust your instinct, right, and believe in your core value. And if you believe in your core value as your North Star, then no matter what decision you make, it's for the betterment and for the good of that company. And number two, you also have to trust the team that you have around you and bring those people that you have trusted with their job to guide you and give you the advice necessary in order to overcome some of those hurdles. So I think we're doing a really good job. I'm very, very proud of the staff that we have, very dedicated team, and our motto is that, listen, there's no task too small, there's no vision too big. And we just know that in the end, we have a goal for the end of 3 years where we want to be, and we're going to hit that goal very confidently, no matter what stands in our way.
Great. So taking Mango RX public in the current climate that you did, that's kind of a bold move. Could you walk through your thought process behind the decision and how you handled the balance between the risk and opportunities?
Absolutely. So I'll kind of give you a little bit more background. So I have a financial background, and I've advised many companies, that private companies, in going public, and been involved assisting public companies in a lot of ways, raising capital or giving them advice and mergers, acquisitions, et cetera. So it's a playground that I'm very familiar with. And I wanted to leverage that to be able to bring my knowledge of taking companies public and my knowledge of growing a business and kind of blend them together. And it was honestly because of that we were able to go public from zero to, NASDAQ within a 7-month period of time, which is a very, very short period of time. I honestly could have gotten it done in 4, but we did a small capital raise beforehand. But anyway, the idea of going public at such an early stage was because our brand is such a consumer-facing brand. And we felt that if we were going to be marketing our company to investors, those investors could ultimately be our customers, and vice versa. Now we have a product that our consumers are purchasing from us. Those consumers could be like, wow, I like this company, I want to invest in the company. So that was part of the reason, if not probably the main reason, why I thought about being public. Giving us that additional visibility into the marketplace would help us outside of some of our competitors that are not publicly traded.
So you personally tested a lot of products and you championed the disruptive approach of Mango RX. How do you balance the line, especially because it's like a healthcare product? So how do you balance that line between groundbreaking innovation and maintaining trust and reliability of the consumers that they want in their healthcare products?
So twofold to that. Number one, a lot of the competitors up until we came on the market, or I should say majority of the competitors out there, they were only selling basically generic commercially available drugs. So you're talking about companies like Hims and Roman and GoodRx and Strut and all these other companies, RexMD, some of these competitors that came out later. They're just selling and marketing ED products that are generic. So generic Viagra, generic Cialis. So that gave us the opportunity to say, you know what, there needs to be something different. And that allowed us to say, we're going to put a compound with 3 ingredients. We're going to make it rapid dissolve so it hits the bloodstream faster, et cetera, et cetera. So we already automatically thought that was going to be one of the key differentiators for go to market. The second point is we wanted to widen the demographic. Currently, a lot of time, the ED market specifically was targeted to men 45 plus. But what has happened in the last 2 years specifically, and especially after COVID, is that ED is a major factor with the younger demographic. But they don't want to admit it because, again, it's a stigma, it's a taboo. They don't want to talk about it. It's embarrassing. But how many kids in these 20s, how many kids didn't have a graduation because of COVID? They were depressed about that. Then they're going into a workplace, and it's, mental health issues are now more prevalent in younger adults, which leads to erectile dysfunction. So we wanted to create a brand that widened the demographic to appeal more to a younger crowd. And that really played into our marketing strategy. And we're going to continue to do that. So we have various marketing strategies for various age demographics, various platforms. For instance, we're going to be utilizing TikTok, Snapchat, and some other influencers for the younger demographic. And we're going to continue on the same, Facebook, Instagram, and Google AdWords for the older demographic. And so in podcasts and things like that. So, again, we felt that there was a market that was untapped with this younger demographic that wasn't really tapped into before. And again, how do you market to them? Be funny, add humor, add elements that resonate with them, things to that nature. So that really played a big approach in how we came to do the our advertising.
Your little bullet list of where you advertised for which demographic totally dated me.
I'm right there with you. Don't worry. I mean, trust me.
I'm always
There's a
laughing
reason I
about
don't have
all it.
TikTok.
I don't have TikTok either. Like I keep
I
hearing
refuse to download TikTok, and my kids are like, "Dad, you got to be on TikTok." I'm like, "Look, I'm okay with Instagram Reels. All right, I'm okay."
yeah.
You know.
Yeah. I'm not even good
So
with Instagram Reels. My marketing team is always, can you make a reel? Like, no, like nobody cares.
yeah, right.
So when you inject humor into your marketing, do you do
Mhm.
that across all the age groups, or do you focus that more on the younger and be more serious with the older demographics?
So we are going to, yeah. The answer is yes. We're humor across all the age groups, and so far it's been very, very well received. However, as we continue to roll out additional products, we do know that we have to have a better blend of clinical and humor. It can't just all be humor, et cetera. There has to be, because again, we are selling a pharmaceutical product. People are getting a consult with the doctor, so this is a very serious issue. So it can't be all fun and games, but we definitely are going to add those humor elements no matter what. Even if we expand more into more of a clinical type of a look and feel through an advertisement or even on a new web design. So
Yeah, that's actually an interesting point because there's a fine line probably between like people really liking your image and your product to taking you seriously enough to put it in their body and say, yeah, like I want to take
correct.
this
Yeah.
pharmaceutical.
And again, and it makes sense for a lot of our competitors like Hims. You go to their site, it's very white, it's very clinical looking, and it works for them. But therein lies an opportunity for us to say, hey, let's take it to the other side of the spectrum and let's see how people react with humor and and using those humorous elements to showcase how our product is different than what's currently in the marketplace.
So, as things move forward in technology, and so how do you envision the future of healthcare technology, especially in personalized medicine, evolving in the next decade?
Healthcare technology. Well, I mean, we're really seeing it evolve quite rapidly now. I think, if anything else, I'm a little scared with how AI has become more prevalent. And not to say that this is going to happen, but I think I was reading somewhere that now they may even be using AI or allowing AI to basically act as doctors to prescribe medicine, which for me is a little scary. But in general, I think that we're on the right path from a technology standpoint, utilizing technology to make people's lives more convenient, doing telemedicine visits as opposed to having to go into the doctor's office and having other technology medical devices that could be monitored at home, again, for people's convenience and for real-time monitoring. So um, outside of the AI function, I haven't really heard much about how technology is going to be continuously advancing where we are now.
So, the concept of disruption often has a lot of uncertainties. Can you describe any times where you had doubt and that you were kind of like having second thoughts about going public or disrupting your industry?
Yeah, I would say that it definitely the idea about going public and the doubts that I had about going public was more market conditions than anything else. When we decided to go public back in it was June of 2020, June or July of 2022, the market was still relatively stable. Companies that were going out on IPO, their stock prices were increasing. There wasn't that much going on in the market from a short position. But then, the fourth quarter started getting dicey, and then the first quarter, and there was a point in time where I was like, you know what, I think we might want to delay the IPO because I feel like if we're just going to get crushed from a valuation standpoint, but we were already so far down the line. We were only weeks away, and we had made representations to our earlier investors that we were going public, and everything was done. So we decided, okay, let's continue on, let's bite the bullet, and hopefully we're not a victim of the current market. And if we are, like time will tell, and we'll recover. So it was a hard decision. It has not been a very easy road. with respect to the public markets, and I'm not the only small cap IPO company that's gone public and has lost valuation. I was just at I was fortunate enough 2 days ago to be at to be invited to a closing bell ceremony at Texas Governor Abbott's house at the mansion in Austin, Texas. And I was there with about 50 other individuals, CEOs of other Texas-based NASDAQ companies. I'm talking to this guy, and he says, "Yeah, this guy went public at a $1 billion valuation, and he's currently trading at a $300 million valuation. So he's lost 70% of value just because of market conditions. And fundamentally, they're a better and stronger company now than they were when they went public." So there are times where it just doesn't make any sense. Our company is more fundamentally strong than we were when we went public, and we went public at a $65 million valuation. So we believe the market will reverse at some point, and we just got to continue to perform, put out good products, and hit our marks. That's the goal of the company.
So as we wrap things up, I want to ask you if you had just one piece of advice that you could offer to a aspiring leader who possibly wants to disrupt their field with innovation, what would that advice be, and how should they prepare for the challenges and opportunities that are going to come from such an endeavor?
Basically, two core elements. Number one, don't be afraid. If you really truly believe in what you're doing, and if what you have or your project, your solution is disruptive, or there's a need in the marketplace for it, and if you truly believe it, don't be afraid. Don't let somebody say, tell you no. Don't let somebody get in your way. If you truly believe it, go for it. That's really what I would say to someone. So, because everyone can take the easy way out and say, you know what, it's going to be too hard. The market's really bad. I can't raise money. You know what, the market won't accept it or whatever. Everyone can have many excuses. But if you truly believe in what you're doing and you believe that there's a need for it in the marketplace, you owe it to yourself to move it forward.
That is awesome. And how can people, we'll put the links to your website and everything with this podcast and in the Authority Magazine article where this will get uploaded as well. Is there anywhere else? Do you want people to reach out to you on LinkedIn, or just head to your website if someone wants to get in touch with you?
Yeah, my LinkedIn profile for sure. It's Jacob Cohen. And, again, mangorx.com. And people can go and see the new products that we have launched, our current products, and very, very excited to have been invited to speak with you today.
Well, thank you so much for joining us and sharing such valuable insights. To our listeners, we hope you enjoyed this conversation. We hope it sparked some new ideas and inspired you to think differently about innovation and disruption in your own field. Remember, the journey of leadership, transformation, and change begins with a single step, and sometimes a leap of faith. Keep pushing boundaries and don't be afraid to disrupt the status quo to create something truly remarkable. Thank you again for joining our podcast, and leaders who care to lead. Thanks for watching the Care to Lead podcast. Don't forget to like, share, subscribe, and hit the notification bell for more videos and updates.